About 50% of trans people experience sexualized violence. Many trans people have had negative experiences in healthcare settings. One study in Ontario, the TransPulse study, found, for instance, that 22% of trans Ontarians would avoid going to the emergency department even when they were in crisis due to fears of how they would be treated.
The survey we're conducting with the Ontario Network of Sexual Assault and Domestic Violence Treatment Centres and in collaboration with our advisory group is to determine whether we're providing trans-sensitive and appropriate care post-victimization. We haven't paid enough attention to date to providing safe, appropriate and sensitive care to trans individuals who experience victimizations. And we know they're at higher risk for being victimized, including sexual assault, based on their gender identity. So it's really important that we, as healthcare providers, researchers, social service providers, etc., reach out, engage individuals in the trans community that have the expertise to try to improve service delivery in regards to violence, but other healthcare related issues as well.
Overall, there's very little research on anything related to trans people's experiences or providers' experiences when working with trans people in the area of violence, including sexualized assault. I'm not aware of anything else in Canada that's happened like this. I became involved with Dr. Dumont's research through my role with Rainbow Health Ontario. I serve as the director for Rainbow Health Ontario, and our role is to help improve the capacity of the health and social service sector to work with lesbian, gay, bi, trans, queer, two-spirit folks. Better evidence will help us to understand what service the providers themselves identify as their learning gaps in order to better serve trans people.
95% of the respondents that I identified as nurses said they would benefit from additional training. We will definitely be working with the advisory group to take our findings and then to seek funding to develop appropriate training.
More sensitive care for trans people can include a provider following a person's lead around what name and pronoun to use and using that consistently. For instance, I'm trans, and in my medical records there's an F on forms, and I would be rather offended if someone used my legal name or called me she. And it would also out me, which puts me again at risk of violence. So for healthcare providers to be sensitive about what's said in a public space, if they don't get that right, it's going to be very hard to build a trusting relationship where somebody is going to be willing to allow them to provide care. Given the extremely high rates of trans people who experience sexualized violence, I can only think about what difference that might make to people's mental and emotional health, their quality of life, their friendship networks, and that's just the beginning.